full committee. Mr. Raskin from Maryland for 5 minutes of questions.
Mr. Chairman, thank you very much. COVID-19 was a catastrophe for our country as Donald Trump presided over an historic debacle of a public health response. And you don't need to go to the American Medical Association or the American Hospital Association or American Nursing Association to conclude that Trump's lethal recklessness and lying led to hundreds of thousands of unnecessary deaths. You just have to go to Donald Trump's own COVID-19 advisor, Dr. Deborah Birx, who said that by undermining mass testing, not more aggressively coordinating vaccination and treatment, not seriously implementing mask mandates, the administration failed to save at least 130,000 lives, and probably a lot more than that. She testified we probably could have decreased fatalities into the 30% less to 40% less range, which translates into the lives of several 100,000 Americans. That's Trump's own COVID-19 advisor. Beyond the million-plus Americans killed in this plague, the public health orders closing our public schools set our educational process back dramatically and undermined the academic, athletic, emotional, and intellectual progress of millions of children across the country. No one can seriously dispute that. And as an educator and a father, I've been horrified by what this plague and the nation's catastrophically ineffectual response to it have done to learning and education among young people. But was it the fault of the governors, Republican and Democratic, who closed the schools in the middle of this emergency? The superintendent struggling to contain this out-of-control pandemic? Was it the fault of the teachers on the front lines, at least 530 of whom died during COVID-19, according to the American Federation of Teachers? Was it the fault of the school children or young people under 18 themselves, more than 1,300 of whom themselves died of COVID-19? Or would it be the fault of the president who let the plague run loose and left the nation without a unified, serious plan for managing the crisis? A president who praised China, China's Central Communist Party and President Xi in their handling of the epidemic on 37 different occasions. Well, let's take PPE, for example. The Trump administration knew as early as January 2020 that the U.S. would not have enough PPE for the pandemic. Instead of taking steps to bolster domestic supply chains, Trump consistently dismissed the impact of COVID, repeatedly assuring the country that China and Xi were doing a great job and had everything under control, and famously predicting that the pandemic would be over by Easter. When it became clear that he was wrong and the country desperately needed PPE, Trump put his unprepared and unqualified son-in-law, Jared Kushner, in charge of obtaining PPE. Instead of working with procurement experts in the federal government, Kushner hired a handful of 20-something friends working in finance in New York, none of whom had any significant procurement experience in order to source and distribute PPE. Ms. Mazik, you're a school nurse with the National Association of School Nurses, headquartered in Silver Spring, Maryland. So you understand the lengths to which schools went to keep kids safe throughout the pandemic. What did it mean for schools when they could not access the PPE they needed to protect the school children against the deadly virus in the spring of 2020?
The unavailability of sufficient PPE, Ranking Member Raskin, was a concern because of the healthcare workers, the school nurses who were working with students. Most immediately, with the healthcare that was happening throughout the nation, healthcare professionals were advised to use PPE. That needed to happen for the school nurses, number one.
Thank you. Well, let's look at testing. It took months for the CDC to develop and distribute a reliable test. First, the Trump administration rejected a protocol test design offered by the World Health Organization in January of 2020. But the administration didn't take any action to incentivize test manufacturing here at home, leaving us defenseless and floundering. And when there were widespread design and contamination issues with the CDC's tests, the administration failed to provide public health centers with any guidance on how to proceed. This meant by the end of February 2020, the entire United States had conducted fewer than 500 tests compared to more than 65,000 in South Korea, for example. How did schools use testing as a tool allowing them to remain open during the pandemic when they had the tests?
Schools collaborated with local health departments, local health authorities to be able to offer testing, and some of them did that testing in school buildings, some did it in centers, testing centers.
All right, Mr. Chairman, in category after category, that administration got an F, and I yield back to you.
I now recognize Ms. Malliotakis from New York for 5 minutes.
Thank you, Mr. Chairman, for hosting this important hearing to